Thank you for inviting me. The title of my presentation is the response to COVID-19, the lessons from South Korea. So I'm a health economist by training, but I'm teaching at the School of Public Health at Seoul National University. Next, please. So this figure shows that the trend in the daily confirmed COVID-19 cases and deaths in South Korea, but the number of deaths is very low, so it's as a bottom line. And for the number of daily confirmed cases, as you can see that in early March, we had a huge number of COVID-19 cases, slightly over 800 daily confirmed cases in early March. But right after that, the number of daily confirmed cases stabilized. And then we have a small spike in mid-August. And then recently, we had even like yesterday and today, the number of confirmed cases touched slightly over 300 cases. So we are currently a bit worried about another wave of COVID-19. Next slide, please. So what are the key characteristics of the response to COVID-19 in Korea? I would say the key characteristics is a rapid and flexible responses. And the rapid and flexible responses was made possible by the preparedness. And in Korea, we had a good preparedness through the low revision and investment in the preparedness, thanks to our experience and policy learning from the past, because we had MERS is a Middle East Respiratory Syndrome 5 years ago, and at that time we had a large number of cases, probably the largest number of cases outside of the Middle East. So after that, I would say it's a painful experience of MERS 5 years ago, we revised the law and we strengthened the Korea Center for Disease Control, expanded its budget, personnel, most importantly, hired a lot of epidemiologists as an officer. And also we introduced a very aggressive contact tracing system. And this type of contact tracing is based on interviews and the IT-based data gathering from credit card use, mobile phone location, and CCTVs. And also we had a system of coordination between central and local government, because as you know, the effective response to COVID-19 and pandemic relies on the collaboration of the central government and local government. And also about 5 years ago, after MERS, we realized how important it is to have a good testing capacity and also the importance of early stage testing. So as a result of this type of preparedness in this COVID-19, Korea had a very minimum restrictions. We had no lockdowns, and we had a very limited negative impact on the economy compared to other high-income countries. Next page, please. And also the Korean response is characterized as a so-called 3T policy. It's a test, tracing and isolate, and treatment. And the government provide a very swift, rapid approval for test kits, which made a mass-scale testing possible, even as early as of mid-February. And then also we introduced some kind of innovative approach for testing, like a drive-through testing. In other words, you drive the car and come to the testing station, and you just stay in your car and you got tested. So this made it possible for a very rapid testing, and we avoided the potential infection because the person doesn't have to get into the facility. They just stay at the car and get tested. And this type of early detection and isolation of cases is very important, because one of the uniqueness of COVID-19, as you know, is that there are many asymptomatic patients. I mean, even if I'm infected, I don't have any symptoms. So, but still, that type of asymptomatic patient can infect others. So, early testing can prevent the infection by these asymptomatic patients. So, next slide, please. So this slide shows that the total confirmed COVID-19 test per 1,000 people. Nowadays, testing is quite prevalent everywhere. So most other countries in the world realize the importance of testing. So many countries have a very high volume of testing. But as you can see, up until mid-March, Korea has the largest number of testing per people. So it shows the importance of, or the role of testing in Korea. Next page, please. So next slide, this slide shows the flexibility, because flexibility and learning by doing is also important, because COVID-19 is a new pandemic. And at the beginning, we didn't have sufficient scientific evidence. So that means that as there are new scientific evidences available, we should be ready to flexibly change, adjust, or fine-tune policy measures. So in other words, quick learning, agile learning, flexible learning, or learning by doing is so important. For example, at the very beginning, we sent all positive cases to the hospitals, and then we realized that there are too many patients in the hospital, so we had some shortage of hospital bed, and we realized that about 80% of those positive cases, they don't have to be treated in the hospital, because there are very mild patients, and those mild patients, it's important for them just to stay in a facility, like a quarantine, but they don't really need a medical treatment. So we introduced a so-called residential or living treatment centers for the majority of positive cases, because they are mild patients. So they are monitored by non-medical personnel, but every day they checked their fever, symptoms, and if their symptoms got worse, of course they are transferred to hospitals. But other than those cases, they just stay in residential treatment centers. And this type of residential treatment centers made hospitals beds available for more severe patients. So this type of flexibility is also very important. Next page, please. So, and also Korea has a national health insurance for universal health coverage. We have a national health insurance covering everybody, all citizens, and all healthcare providers. So that means that the Korean people did not face any financial barrier to testing or treatment, because testing and treatments are free, funded by either national health insurance or government budget. And also this national health insurance system rapidly responded to COVID-19 by expanding the benefit packages for medicines and services for COVID-19. And also they provided some exemption and discount of contribution for those severely affected. And also they provide some amount of advance payment to private hospitals, because at the beginning, private hospitals suffered from cash shortages. So this type of response, rapid response by the health insurance system is very important as well. And next page, please. And this Korean national health insurance is also unique, because it covers the entire population, 100% of the population, all providers, both public and providers, and also it is based on a unique ID, and it has and it's based on a very good data infrastructure. For example, like a drug utilization review is a modern IT-based approach. It checks all those drug prescription and drug dispensing as a real-time basis. And also, not only public but also all private hospitals providers should join. It's a mandate for all healthcare providers to join NHI. So it's very important to mobilize the private providers, not only in testing, but also in treatment of patients. And also many hospitals, they introduce a separate paths for respiratory patient and non-respiratory patient, because many COVID-19 patients, the symptoms are very similar to flus and other respiratory symptoms. So to avoid the potential infection, many hospitals introduce the separate paths for respiratory patient. And also we activated telemedicine and prescription without visits to improve access to healthcare in the COVID-19. And this is a drug utilization system, as I mentioned. So there's a real-time exchange of data between healthcare providers and pharmacies, and there is a real-time, like it takes less than 3 seconds to check whether they are properly prescribed and dispenses. So pharmacy also played a very important role to check whether what kind of medicines are being taken by people. And also role of ICT is very important. Contact tracing is primarily based on interviews, but they are supplemented by a lot of information from various sources, as I mentioned, from like mobile phone locations, credit card use. But there are a lot of privacy and information protection issues. So this is all based on law. Okay, and also government applied a app for quarantine, and these apps are for those who are in quarantine, and also these apps are separate apps for the government officers in charge to monitor and also provide some support to those in quarantine. And also National Health Insurance System is a very extensive database covering everybody, every citizen, and all healthcare providers, and they check the use of healthcare and medicines. This is the information flow. So there's the next slide shows that the information flow from data sources, data categories. So data is from mobile phone carriers, immigration services, police, credit card, public transit. They are all collected for the contact tracing. Next slide, please. Next slide shows the app for the person in quarantine. So this app, twice per day, self-checking and reporting of 4 symptoms like fever, cough, sore throat, and breathing problems through this app. And also this app provides guidelines for those in quarantine, also family members, and also the person in quarantine can contact the public officer in charge. And next slide, please. Next slide shows the app for the officer to monitor quarantine. So through this app, the officer receives and confirms the reporting form from those in quarantine, again twice per day. And also the officer uses this app to monitor the compliance or adherence of those in the quarantine, like where the person is located now. So these type of apps are quite useful to improve the performance in the response. Next page. So this is my final slide, the challenges and lessons. Although so far Korean system did quite well overall in the response to COVID-19, but it's not perfect. We also have some problems, such as the protection of vulnerable population. It's a very important challenge because I think all around the world, the older people, the elderly, are the most vulnerable population. The mortality is very high for old people. For young people, the mortality is very low, negligible. But the majority of the deaths of COVID-19, they are from the old people. So we should do our best to protect this vulnerable population, should do our best to minimize infections in elderly care facilities, geriatric hospitals. And also there are other vulnerable populations like poor people, daily workers, because they cannot work from home and they are worried about job loss. I mean, if you work in a large corporation, they can work from home. They are protected. But there are many vulnerable workers or workers in small business. They are not well protected. So it's very important to provide good protection, good safety nets for those economically vulnerable or medically vulnerable population. So protection of the vulnerable population is the key. And also second issue, this is a bit delicate issue. As I mentioned, Korean contact tracing is quite successful, very aggressive, but there's some delicate issue of privacy. Although it is based on law, so it is based on social consensus, but still we should do our best to minimize the potential harm, potential negative impact of this type of contact tracing on the privacy issues. And also, local government provide information to the people about which places this infected person visited. Then when people got this information, they came forward to the testing centers and they get tested. So this type of information disclosure to the general public is quite important, quite effective. But again, although this type of information disclosure contribute to achieving public health goals, but at the same time, we should do our best to consider what is the minimum amount of information, okay, and at the same time to achieve public health goals. Because if you provide too much information to the general public, there are potential harmful impact on the privacy issues. So we should consider this potential trade-off in the privacy, information disclosure, and public health goals. Thank you. This is the end of my presentation.